Good afternoon, everyone. Hopefully you really enjoyed the lunch, and it's exciting to get started with this session titled Community Engaged Research in Economic Mobility and Poverty. I'm Arti Rao, and I'll be moderating this session. I'm a senior research scientist at Georgia Tech, and I'm also a co-investigator at the center. And certainly economic mobility is a topic that's very near and dear to the center's work. I particularly work in the area of understanding the impact of place on economic mobility. So I'm very excited to hear about community perspectives and how these are informing policies. The way we'd like to do this panel is we have three very exciting presentations on various mechanisms of promoting economic mobility. So we'll hear from each of the three groups about 15 minutes each, and then we'll have about 15 minutes to engage in questions at the end. I would request that each of the presenting groups be seated on the stage after they're done with their slides, so that we can have a very engaging conversation and a panel discussion at the end. I believe we will have microphones so y'all can come up to ask your question. And without further delays, I would like to introduce our first group that represent the Multnomah Idea Lab, and they are going to talk to us about a basic income project. So welcome, and we look forward to your presentation.
Thank you, everyone, and good afternoon. Do both these work? Excellent. My name is Ebonee Bell, and I am representing the Multnomah Idea Lab and the Multnomah Mothers Trust, which is a basic income project in Portland, Oregon. And I am lucky enough to be accompanied by my co-presenters, Voycetta White and Kesha Canda, who are members of the Multnomah Mothers Trust. Do you guys want to introduce yourselves and then we'll come back to me? Okay.
I'm Voycetta White, a member of the Multnomah Mothers Trust. I am a mother of 4, and my education credentials, I am a certified para-optometric, and as of Monday, June 3rd, I'm actually a licensed optician.
Hello, my name is Kesha Canda. I'm a domestic violence survivor. I'm a single mother of 3 children. I am a domestic violence advocate, and I'm a certified pharmacy technician. Thank you for letting me be here.
And I said it before, but I'll say again, my name is Ebonee Bell, and I am a research evaluation analyst for Multnomah County, at least for the rest of the month. And then I'll start a new position on July 1. Today, though, we want to talk about some of the dynamics that are happening in Oregon and why we felt that it was appropriate to have a basic income for African-American women. So, oh, look, there we are. Yeah, the City Talkin' We Taking Notes is actually a lyric. It's a song lyric from the Lil Nas X song, Industry Baby. And I gave this same talk well, not exactly the same talk, but I gave a version of this talk to youth. And I wanted something like young, and I love that song. And when I did it for the kids, I sang it. I was like, I told you long ago on the road. You know the song? I got what you was never really rooting for me anyway. When I'm back up at the top, I want to hear you say. That's right. So I loved it because of the defiance of that song. And I thought that would sort of exemplify the sort of spirit of the presentation that I wanted. And so I put it in the title so that you would get the correct spirit of the presentation, and then my program got cut. So I'm not happy about that part, but I still have the defiant spirit, so I didn't change the title. We just left it the same. Can we, I could go to the next slide. Maybe, please. I hope. Okay, we did it. All right, so here's a little bit about how this is gonna go. And we're gonna go super fast because we thought we had more time than that. So should we invest in Black mothers? Yes, we should. I answered that question already. Okay, next slide. So in Oregon, it's famously in Oregon, we had Black exclusion laws. So Oregon enters the Union in 1858, 1857, and it enters as a non-slave holding state. And it also said that Black people could not reside in the state at the same time. So it's anti-slavery and don't come here, please. And there were reasons for that. So it was going to be white farming communities, and they did not want to compete with slave labor, but they also didn't want to compete with free Black labor. So just don't come. And as far as we know, Jacob Vanderpool, who he owned, I should go to the next slide. Jacob Vanderpool is the only Black man to have been thrown out under the Black exclusion laws that we know of. So he owned a hotel and a saloon and all that stuff. And then a white competitor wanted to start a hotel, and he understood that Jacob Vanderpool was Black. And so he told the judge, and the judge was like, oh, well, you have to leave. That's one way to get rid of competition. That's very clever. A lot of the Black population of Portland comes during World War II to work in the Kaiser shipyards. And so a lot of the Black population of Portland is actually from the South. You have Louisiana, Georgia, Mississippi represented among the generations of Black people who live in Portland today. And this is an article from the Oregonian about how we don't want people, the Kaiser specials. The Kaiser was the shipyard magnate, and it's the same Kaiser that started Kaiser Permanente. So the Kaiser specials are bringing in all these Black people, which they didn't want. Housing Authority of Portland decided that they could stop the influx of Black people by not building enough housing. It's a terrible solution to the problem. We still have housing problems as a result. This was from 1991 when the skinheads became really popular in Oregon. We're not doing good. I'm going to summarize. Okay, so 36% of Black Oregonians own homes. This was from National Geographic, and they asked, Oregon once legally banned Black people. Has the state reconciled its racist past? No. That was easy. Oh, it skips a lot. Well, that's not the slide I wanted. So from the document Advancing Racial Equity through the American Rescue Plan funds, we get this paragraph. And I wanted to point out that our project, which began with $500 for technology, it met a lot of the criteria that was elucidated in this document about how American Rescue Plan funds should be used. So we did dedicate money to a historically constrained group, which identified it was flexible. We had support outreach navigators. That would be like someone like me. We had community engagement. There was the first $500, which was for technology. It was flexible funding. It included metrics. The only thing we don't have is maintenance of equity because we're not continuing. This was from William Darity about the cost of the racial wealth gap. Our project was meant to reduce the racial wealth gap between Black and white residents of Oregon or Multnomah County. Darity points out that all of the things that we currently do are only going to have very slight improvements to that racial wealth gap. This begins a long, long quiz, which I probably will give you like 2 or 3 questions from it, and then we'll get to Voycetta and Kesha's part. But I want to ask you at least a couple of these questions. Okay. Which US state has the highest rate of Black home ownership? Is it A, South Carolina, B, Delaware, C, Mississippi, or D, Georgia? Raise your hand if you think it is A. Quickly. Okay. How about B, Delaware? Okay, some Delaware. C, Mississippi. Okay, and D, Georgia. Oh, we have a lot of people who believe it's Georgia. If you said A, South Carolina, you are correct. One person. Delaware and Mississippi are tied for the second highest rates of Black home ownership, and Georgia doesn't come next. Alabama and Wyoming follow. Black households with a college degree hold as much wealth as, or $55,000 less than white households who lack a high school diploma. $22,000 less than household heads who lack a high school diploma. $9,000 less, or about the same. What are we thinking, people? How many people think it's A? Raise your hand if you think it's that. Oh, a lot of A's. Okay, raise your hand if you think it's B. Great. Raise your hand if you think it's C. $9,000. I don't know if there's somebody in the back with 9,000. How many people think it's about the same? Okay. Black household heads with a college degree hold $22,000 less wealth than white household heads who lack a high school diploma. Yeah, it is. How about this? What if you have an advanced degree? Like, what if you have a master's degree or a PhD or something like that? Black household heads with advanced degrees hold about a third of the wealth of white households with a BA, about a quarter, half the wealth of white households with a bachelor's degree, or about 3/4. How many people think it's a third? Okay, some people. How many people think it's a quarter? All right. How many people think it's half? All right, we got some halves and 3/4. Okay, some people think 3/4, that's good. If you said half, you were right. Here's the graph. Black people with MAs and PhDs are at the very end with $132,000 worth of wealth versus bachelor's degree, that blue column for white people. And I'm gonna end with that. And we're gonna skip all the way to the end. And I'm gonna let Voycetta and Kesha talk about what it was like to be in the Multnomah Mothers Trust.
Hello, you guys. I'm Voycetta again. Thank you for having me. I am a formerly incarcerated Black woman. I did 85 months in Coffee Creek Correctional Facility. No one in my family has went to college since my sister. Me and my sister are 10 years apart, and I'm 45. She went to college in 1989. So when I got incarcerated, I knew that I needed to change the dynamics and break the barriers in my life. So I got as much education as I could there, and that's where I became a certified para-optometric through Portland Community College while I was in prison. When I got out, I was an intern for the Oregon's Lion Sight and Hearing Foundation, and I only was part-time. That's when Ebonee came in with the Multnomah Mothers Trust program, and it gave me like a basic income, so I didn't have to like really struggle as I'm working part-time, as I'm trying to break the barriers and cycle and don't want to go backwards in my life. So that basic income let me be able to work on myself, work on my children, get them steady, be able to go to work, be able to continue my education without having the fear of I have just this basic income as my job to pay. I believe basic income is a very phenomenal help for Black women because there's no stipulations on this income. You don't have to worry about, oh, I wanted to do something for my children, or I wanted to have a personal day for me, and without the government tallying that down. So that was able to make me breathe. And my daughter might have said, I need to pay for my sports. I don't have to tally that down like this has to be done for rent. Oh, I could put my baby in sports this year. I got one getting ready to graduate next week and has a full ride scholarship to college. So this basic income has helped me break the barriers and continue to move forward in my life and continue my education. Like I said, I was able to just get my license Monday without having to say, I was able to quit my second job and just focus and say, I got this basic income over here. This is gonna cover my other bills. I need to further my education. And I believe if they continue to give out basic income to mothers and women that look like me, it will break so many barriers in the future for women having to look for other means to do things that they shouldn't do to survive. Thank you for having me.
Hello, my name is Kesha Canda. As I stated before, I'm a domestic violence survivor. When the Mother's Trust program was presented to me, I had just left a 20-year relationship. And I was a single mother, like I said. Yes, I had a great job being a pharmacy technician. But once I found out being single and being the mother of 3 children, the money really wasn't that great. You know, I had rent, lights, phone bills. I had so many bills that was just adding up, obviously just for me on my own. My children's father told me he would not help me. He was not going to help me. And not only that, I had a son that was in private school, so I had to pay that private school tuition as well. So like I said, when the Mother's Trust came into my life, I was at a bad point. I was wondering if I made the right decision of leaving that relationship because my mental wasn't that great because of the bills that I had to carry on my own. So when the Mother's Trust came to me, I was very blessed because I was able to put the money where it needed to be and put the love and support into my children. And with that, thank you. Thank you. I was able, like I said, to finish putting my son through the Catholic school that like I said, was paying on my own. I'm just grateful for the basic income because like I said, it just allowed so many great things for me. I went on to be a domestic violence advocate. My son graduated from high school. Yes, he is in college. I was able to help him pay his rent while he was in college. And I've been on the road to leadership ever since. And it was because of that income that was given to me to support my family. You know, people think, oh, what is she going to do when this person gets this money? They're going to take care of their family, because that's what I did. You know, you see women every day, we're walking around sometimes we act like everything is okay and we got a lot going on inside. And that's exactly how it was. I had so much going on inside, but when this opportunity came, you know, I get a stipend every month to spend and invest in my family. It was a blessing. And I wish that this program could continue because it's not always about the money. It's also about the person's mental. How am I supposed to support my children and be strong when I'm so worried about my rent, my lights, my car insurance, my phone? How are my kids supposed to eat? You know, and the list goes on and on. So I just want to say the basic income, it works. It's an amazing program. And I wish it was something that was offered to everyone and in every state. And it, you know, like Ebonee said, you know, it got cut in Portland, Oregon. And it makes me sad because they don't realize what they're really doing. They don't realize that the investment that's put into someone like me to be able to hold my head high, not think of even going back to something that was so damaging to me and my children. So I just want to say thank you for letting me be here. And I think basic income is amazing, and I wish it continues for many more years to come.
We have a few minutes left. I was wondering, Voycetta, you were part of the Multnomah Mothers Trust home ownership design process. Can you tell us a little bit about that?
So when I got out of prison, my credit score, you guys, was 420. I couldn't even get leased on to my apartment that my fiance had for me at the time. So in the home ownership program, I was working on my credit. So they gave us a stipend of $3,000 to put on a home, to pay off debt, whatever. I took that $3,000 and I got to dwindling down like, hey, this is my goal. Like, it helped me. Now I have a credit score of 704, I think.
Oh.
So like, I'll be watching my credit. I'm always in my email like, hey, wait, what's going on? Oh, this is like, oh, no, we can't do that. So it gave me stability. It helped me focus. Like, because before I went to prison, I didn't know nothing about credit and homeownership and none of that. So I'm learning a lot and I'm being very blessed. This program needs to stay.
Thank you. I was just going to say, we only have a couple of minutes left, but I did want to share some of the statistics from the Multnomah Mothers Trust. We had, out of the 100 African-American women that were a part of this project, 3 of those women were able to buy homes. We did not make that as one of the goals. It was just a very fortunate outcome. In fact, one of the women in the trust sent me a text of a picture of her hand holding some keys. And she said, with the last month's stipend, I was able to buy a home. So she did it with the money from June.
Yeah.
And then we had one woman start her own business. And that same woman is also graduating from college this June. We had another woman. We had a couple of people
Go back to school.
go back. I was just about to say, we had a couple of people go back to school. And what I did not understand before I became a part of this project, I've been doing it for 2.5 years, is that when we give people the flexibility to determine how they're going to spend their own money, then they choose to make economic decisions that are going to improve their long-term economic outcome. So people are going back to school with this money. People are taking risks. Of course, going back to school is risky because you have to pay for that. But people are investing in their own economic futures. And when we do that, we give people hope in a different future and a different outcome. So anything else you guys wanted to say before we wrap up?
I was told when I was taking my test, I went to a conference last weekend about continuing my education, and the guy said, once you pass this test, I need you to go all the way. So I felt so good, and I broke down when I was in that room when I passed. I said, so now I'm gonna go and get my ABO master's. I'm gonna keep going. I can do this.
I wanted to say, being a part of the Mother's Trust was just amazing. You know, we had Ebonee by our side who was amazing, working with us, giving us different opportunities, even like today. But I also want to say that I gained a lot of sisters in this process. Sometimes when you are single, you're on the alone, things can be hard. And so you just get to lean on some of your sisters and they have your back. And it was just an amazing program. And I was just blessed to be in it. And I was blessed to be around some beautiful, strong Black women. And I just want this program to continue to stay.
Ebonee has fought for us like no other Black woman I've known. She will not take the credit, but I keep letting her know each and every day, it's women like you that believe in us and see something, and you keep going to the top fighting for it, and I appreciate that. So when she sends something out, I'm here for her any given time. Thank you.
Thank you. Oh, sure. Sorry.
Okay, we'd love to have, or thank you so much for those very inspiring and moving stories. We appreciate you sharing them with us. And at this time, I'd like to call upon our second group of presenters. So.
All right, hello, hello, hello. Greetings. I think the first slide will come up. But my name is Aaron Quick. I am a graduate candidate, oh my goodness, from Clark Atlanta University. I actually see some CIU people in the house. What's up, what's up, what's up? So honored to be here. I am one of the research students who were a part of the Inheritance Project, which we'll get into, and I'll let my fellow researchers introduce themselves.
Hello, happy Thursday, everybody. My name is Desha, Elliott. As well, I'm a doctoral candidate at the Whitney M. Young Junior School of Social Work at Clark Atlanta University. And I'll pass it to my colleague, Simone.
Hi, everyone. My name is Simone Smith. I'm also a doctoral candidate at Whitney M. Young School of Social Work at Clark Atlanta University. And we're research assistants for the In Her Hands project.
All right, all right, all right. And so, yes, so what we're going to talk about today is, yes, the research that we did with the In Her Hands project, and specifically the impact of guaranteed income on racial and economic justice. All right. And so really what our presentation today will focus on is our 1-year findings from this program. And so just telling you a little bit about what the agenda will be. I'm sorry, the wording is a little smaller, but we're going to get into the project design. We're going to talk about the research design. We're going to then go into our different findings that we found and that we discovered during the process of that first year. And then we'll eventually just close with a little bit, and then at the very end, with once everyone is done, hopefully we'll have time for some discussion. All right, and so our project design focused on about 654 Black women throughout the Atlanta area, not the Atlanta area, the Georgia area, Southwest Georgia, College Park, and then the Old Fourth Ward. We split up our groups into two kind of specific groups. One group received $850 for 24 months, and then we had another group that got a lump sum of $4,300 and then $700 for 32 months. The purpose of that was to see, when we're giving individuals that guaranteed income, is it beneficial to give them the same amount for the allotted time, or if that lump sum at the very beginning is actually more beneficial and then a smaller amount as they go throughout the program. Our eligibility criteria was, of course, they had to be from Georgia, at least 18 years old, identify as a Black woman, and could not have an income more than 200% over the poverty level. And so community-based participatory research, that is the foundation of the work that we did. And we see that this approach to research is very beneficial. Specifically, we come from a standpoint of do no harm. We know historically, and I'm sure all of us know, that research has historically been very predatory towards marginalized groups, using them as guinea pigs to do research and then leave them with absolutely no benefits from that research whatsoever. Majority of the time benefiting the affluent, our white population. And so the point of doing this community-based participatory research is to ensure that the communities that we're in are actually having a say in not only how we are using the research, but how we are presenting it as well, to ensure that their voice and their experiences are accurately being represented when we present this work, whether it be to legislators, whether it be in conferences like this, because at the end of it all, we want this research to be able to impact policy and impact programs. We don't want it to stop at our research. We want this research to do something that will be permanent, and this is what we continue to advocate for. And so continually throughout the entire process, the community, the Black women in which we were working with or who wanted to be advocates for the community, were always with us at community meetings and different things like that to ensure that we are doing the absolute best work with this research. And so a little bit about the timeline. This program started in June, the summer of 2022. That's when we launched the program. During that summer and that fall of the same year, we had the initial community meetings, again, asking them, what do you think about these questions that we want to ask in our interviews? And to that point, we had surveys that we did, and then we had every 6 months, we did qualitative interviews, which is actually what we did. So we actually were a part of those qualitative interviews. And so when it came to those interviews and those survey questions, we went to the community and asked, what do you think about these questions? Are they too intrusive? Do you think they're easy to understand? Do you think they're actually beneficial to the work that we're trying to do? What is your thought on that? And that was what those initial community meetings were about. And then in December of 2023, we had our 1-year co-interpretation session. Again, now that we've gathered all this data, how do you think it should be interpreted? How do you think that we should be wording different things and different aspects of using this data that best represents your voice, your experience, and how you went through this program? And then actually yesterday, we had our phase 2 community advisory meeting, because now we will be expanding this program. And so we're excited about that. And so our research question in design, our primary question was, what are the effects of guaranteed income on the following areas? On health, income, assets, family relationships, well-being, employment, and future orientation. Again, we use those biannual surveys, and then every 6 months we also did our qualitative interviews. And again, we wanted to look at what's guaranteed income's impact, not just financially on these Black women, but their overall well-being. And so that's really what our research focused on. All right, and I'm going to spend a little bit of time here in regards to our demographics. What I want to really point out and ensure that we understand is that over here in this third column is our treatment. And so those are the 654 women that were actually in our program receiving guaranteed income. However, what we compared that to is that we had a significant number of women apply for the program. However, of course, everyone unfortunately was not able to be implemented into the program. And so our comparison group is 2,000 women who agreed that even though if they're not in the program, we could still use them as a comparison group. And so what you're going to see throughout our finding is that we're comparing our treatment, the women, the outcomes of the women who were in the program to those 2,000 women. And what we're demonstrating with these numbers, really just to make it simple, is that those who were in our program do accurately represent the majority of Black women and their experience in Georgia. Because we know if for example, if the government benefits, if our treatment program was receiving significantly more or significantly less than those of the overall population, we couldn't use our data to generalize that experience and the potential benefit of this program. And so we did our due diligence to ensure that the women in our program do accurately reflect the experience of the generalized population of Black women in Atlanta, in the number of adults in the household, the number of children in the household, age, race, government benefits, and then of course, annual income. All right, and then I'm going to pass it over to Desha to start on our findings. Do you want me to click it or do you? Okay.
So we'll see here that of the top usages that the participants spent the money on, number one is the catching up or the getting ahead on bills at 45.4%. And it's noted we were able to pull out certain quotes about the participants' experience or what it is that they were able to do. We had a photo voice project. So you'll see the quotes as well as some of the images that we were able to get permission to use from the participants. And so one of the things to highlight here is that one participant noticed that the in her hands payment really helped them to financially keep up with the bills every month and catch up. But then it's also important that for those who used it for mortgages, household items, essential needs, they also noted that they've been able to spend more time having fun with their children. Next slide. In regards to the financial hardships that they experienced 6 months into the program, we'll see that of the treatment group, 51% skipped a utility bill versus the comparison group that had skipped the utility bill at 69%. And so it's important to know that, again, the participants related that having the in her hands payments helped them to stay afloat, take care of kids, and make sure that they had a roof over their head. But there were still times where, as these participants were catching up on bills, that they still experienced certain hardships. Next slide. During the 6-month check-in, we were able to note that bank account overdrafts were high among both the comparison and the treatment groups. And then if we go to the next slide, that also relates to the fact that that for our participants, when they first started out, over 50% of them were experiencing overdrafts or insufficient funds in their bank account. And then 12 months in, we were able to see that decrease to where it was, I'd say maybe less than that, 39% or so that were experiencing these insufficient funds. And the quote I appreciate from one participant, "My situation changed from being broke to okay." So, we were able to see that shift, not only from a qualitative standpoint, but a quantitative as well. Next slide. And the upside of that is that percentages of participants that were able to set aside rainy day funds increase. And so at the start of the program, we were able to see that maybe less than 20% of participants were able to do that. But then 12 months in, they were able to have that at least close to almost 30% of them were able to set aside funds. One participant related to me in an interview that they were able to save close to $8,000. And I had to check my bank account and see if I had $8,000. So, very inspiring. Next slide.
All right, and so in regarding education enrollment, we saw at the very beginning of the program when we were doing our initial interviews that there was a significant amount of women who indicated that I'm either wanting to go back to school to finish or go back because I want my education. And so we actually saw a significant increase again compared to those 2,000 that unfortunately were not able to be in our program. But we saw that in comparison, about 6% more were able to actually get enrolled into school in a diverse of different practices and backgrounds. And so, again, one of the just a quote was that my main focus was to get back to school. And so we saw that again, we are fighting back against those stereotypes around things like the welfare queen, that you're going to misuse the funds, you're not going to go back to school. And again, that guaranteed income of allowing them the freedom to do as they see fit gave them the ability to do what I believe is best, not only for myself, but for my entire family. And again, those photo voices, we got people going back to veterinary school and many different other things. They sent us their class schedule. And so it was fantastic to see that. Food and nutrition security. There were conversations that we had about, food stamps and different other government resources not being sufficient. And so what we saw is a significant reduction for those, for the women in our program in regards to, not having food that did not last, in regards to relying on going to food banks and getting food for free, which many times does not give them balanced meals. We saw women talk about, I was able to go to the grocery store and get the healthy food, the produce that I usually did not have access to or could not afford. And so in regards to that food security and just increasing nutrition, we saw that positive and no longer those food insecurities being a barrier for women in the program.
Right. And also looking at the comparison group versus the treatment group, we see that those in the treatment group reported having more healthier days over the past month. Also, 32.3% of participants reported that their health as either very good or excellent compared to 26% in the comparison group. Participants were also less likely to report having to forego necessary medical care due to the inability to afford it. Then, just as Aaron just stated, we see that participants now have access to healthier foods because they can afford healthier food options and create more balanced meals. And now, using the Kessler-10 psychological distress scale, we see that 44% of the participants were likely to report having likely to know mental health disorder. And this assesses anxiety and depressive symptoms. Also, those in the treatment group reported fairly to good, very good sleep quality over the past month. Now, we wanted to share this quote from one of the participants who wanted to just express her experiences in the In Her Hands program. So remarking on this picture, she says, "I know it's just a photo of my nails, but it represents self-love, which is invaluable to me. When I received the grant from In Her Hands, I was homeless and sleeping in the park, grieving the loss of my mom and the father of my children. I was depressed and not taking care of myself. Even with the grant, I had to make sacrifices to secure stable housing. So self-care was a low priority. Once I took care of the essentials, I treated myself to a manicure and started to look presentable again. Now, it may sound trivial, however, but people often live according to how they feel and their circumstances. Thanks to the In Her Hands program, I was able to afford a hotel room for my kids and myself and even seek employment. Without this program offering me hope, I'd still be in that park. I'm forever grateful. And this is from one of our participants in the College Park area.
If I can add to that quickly, I think we know historically, and even research has shown that self-esteem is attached to, women's overall mental and spiritual health. And of course, that then impacts their children and the rest of their family, specifically if they're the primary care provider. And so again, unpacking this idea of what is needed and what's not, that ability for her to be able to just get that manicure impacted her own self-esteem. And just to talk about another individual as we're wrapping up, they talked about, I was able to take my kids on vacation for the first time ever. I was able to get my kids Christmas presents for the first time ever. And so many times we think that, well, that's not necessary, but it actually is. It actually is very needed for those things that, yes, is it going back to school? No, but it is having a long-lasting effect, not only on the children, but then also their own self-esteem, which is vital and which is very important, and which we knew was very important for this program, to not just look at the financial, but also look at the overall individual and well-being. And so that is all we have for now. If you wanted to see our full 30-page report and wanted to read all that, please feel free to scan the QR code. And also our research lead, Leah Hamilton, she's in the back. You can stand up, you can wave, they can see. If you wanted to reach out to her just to get more about the program and all the details and stuff like that, please feel free to grab her email. And yeah, we're super excited to see where this program continues to go. We know it's needed, and we're hoping and praying to connect with others to continue to spread programs like this to improve the life of Black women. So thank you so much.
Thank you so much for sharing the stories, but also showing us how we can use data to, present evidence on the impact of these programs. So thank you for that. And now I'd like to call upon our third presenter, Avis Files. Okay. It looks like we're not going to be hearing from him, which gives us more time to talk about, everything that you've heard from our panelists. And I'd love for y'all to ask questions of the presenters on stage. Y'all can come up and ask them questions. Well, I'd love to ask a question to get us started. Okay. So I'm interested in the sustainability of these programs, right? And we're now constantly being bombarded by so many threats to economic security, whether it's climate change, whether it's AI, whether it's the pandemic. So I want to hear more about who are the kind of the advocates and the champions to get these programs started, what motivates, the implementation of these programs. I would love to hear more about why they ended the program, and then your thoughts on how we can make this stick for a longer time. So, we always have this fallback.
Do you want to start? I can.
I'm thinking for diplomatic words. I need
Well, I would say in regards to sustainability and how to make programs like this stick is to vote. is definitely to vote, and to be aware of the individuals that you are voting for. And we were actually in our meeting yesterday, we were having this conversation. And I think what y'all did today was actually very beautiful, is allowing these individuals who are in our program to use their voice, specifically when we're talking to politicians, when we're talking to individuals who represent the community, is allow them to use their voice. One thing that we were talking about yesterday is, creating an outline of a letter that specifically that highlights our program and what we've done, and allowing participants, and specifically women who've been in the program, to simply sign their name and send it to their representative, letting them know the benefits of these program. And, politicians like numbers. And so we would include the numbers and statistics within that, and asking for more, specifically as we go from, these private research, kind of silos that we have, to something more federal, something more across the board, be it federal or state. We have to use our voice and the political power that we do have, which is our voice and also our vote. And so I would say, when we think about sustainability, it starts to go beyond just what we are doing as researchers. And again, putting the voice and the power back into those people who have been in the program, because their stories are powerful and they're moving. And many times it's when we are sharing those stories, and along with the statistics with our representatives, that we are able to make change. And historically, we've seen that we've been able to do that. And I think no matter who's in that office, we can continue to do that.
Voices is trying to tell me what I should say. Here's what I'll say. We did not get cut because we didn't have measurable statistics and outcomes that were amazing. We had great outcomes. And we didn't get cut because we were a program that was helping Black women. So, and I thought those would be the major determinants of whether the program would continue. People would say, oh, well, you guys should serve this other group of women, my answer to that is, okay, great. Let's increase the funding and I will serve whoever you want me to serve. But I will say that when it did come time to go to the budget hearings, the participants in the Multnomah Mothers Trust, they did show up and they did testify to the board. And both of you guys did testify to the board. So it is, it's not something that the commissioners in Multnomah County are unaware of, but perhaps there's a short-sightedness in terms of, well, should we do this, or how is this helping enough people? I don't know. I don't have a good explanation for why you wouldn't continue a program where one of the statistics is 3% of people bought homes. And, the statistician on our team, he was like, well, most people would say this is not a group that we should even think about trying to help buy homes. That's not an aim of a program like ours, and it shouldn't be. But Dr. William Jackson, he said we should dream the sorts of lives that participants want for themselves. And so when I think about that instruction, I think our program accomplishes that instruction. And so I'm like, well, we don't at the moment exist, but we create the realities that we dream of. And so in that sense, I think we will in the future exist again. Did you guys want to add something to that?
I do think our voices were very powerful when we went to the budget. I've seen a lot of the commissioners taking notes because they don't know. They didn't know about the project, and they don't know what it's done for us until they hear us. They just cut it. And it's like, once they heard our impactful stories, I think I even brought my youngest daughter with me. So you can see what the good that's come out of this program. Like, it's not just, you're just giving away free money. No, we utilize this to do something better with our lives. And there's more women out there that's struggling that need to be able to gain from this program as well. So I hope they do continue it.
I got to, yeah, I went to lobby and I also got to speak to one of the commissioners as well, doing a little bit extra. And I got to be the voice of a lot of women. And when she heard from me, she was very pleased and also kind of saddened that it was cut. And she said, maybe it's something that can come again in the future. And I just let her know, it was so sad to me that, this is so much of an important thing that you guys didn't even come take a look or even beforehand, just see what we're about before you're just cutting things. Maybe if you would have, just to put a little bit of time in something, you would have seen how awesome we are and the women, how hard we worked. And we may look like everyday women, which we are, but all of us are kind of still struggling inside. And this little, this stipend, this piece of the Mother's Trust allowed us to hold our heads up and be empowered and keep on moving. And so it's just when people are making these important decisions, it's just important that when we have a chance, we speak up and say, next time, do you think you could take a look before you cut something? Can you find out what's going on? Come to the people, come see where they're at. And if they would have came and seen where we were at, some of us where we were and where we're going and where we're still going to go, then I don't see how a program like the Mother's Trust could be cut. So, yeah, I'm definitely going to always try to do my part. Being in this program, yes, it's definitely empowered me. Like I said, I'm a domestic violence advocate. I'm going to continue to speak up. Even though I've been scared to speak up, I'm still speaking up. I've even went down to the state capitol to speak on different things. So, so once you light a fire under us, we're going to keep on going. So I don't think this won't be the last that they'll hear from us. We're still going to stick up and stand out as much as we can.
Thank you. We'd love to hear from the audience.
I am so honored to see both of these intriguing and impactful research presentations, and just the information from you all is such a wealth of knowledge. My focus of research is on poverty reduction efforts, so I have a couple of questions. Now that your program is over from the first presentation, what are some of the lessons learned and now opportunities to think about how to repackage, revamp, and try to revitalize this amazing seed that you have planted? And then my second question is, we are here in the state of Georgia, which is, mostly purple, reddish state. And with that conservative type of connotation, how can we package a program like this to make it generalizable to a degree that we can extend this across our community to create those pathways of intergenerational prosperity efforts? And then my third question is for the second group. When you were doing your research, I was fascinated to see that you did go from not just looking at the metro-based poverty data, you looked outskirts as well. Why not? I'm curious to know, why not choose Hancock County, which is one of the most impoverished communities according to BRFSS, or looking at maybe like a 31903, which is one of the most impoverished zip codes in Georgia? So just kind of wanted to throw some curious questions and some additional food for thought here. But again, I'm thankful and I really appreciate this information. And my last caveat, could we have copies of the presentation if that is something that is offered as well?
Well, when I entered DCHS, I had come from Multnomah County Library to Department of County Human Services in Multnomah County for this position. And at that time, Commissioner Jayapal was one of the commissioners who was a part of Mayors for a Guaranteed Income. She stepped down from her position to run for state rep. And so we lost one of our main supporters when that happened. And then we got an interim commissioner. And we also gained a commissioner who wasn't necessarily supportive of basic income. So sort of political circumstances changed such that we did not have the support that brought me into DCHS in the first place. I don't know what we could have done, because it requires a sustained commitment over a long period of time. And so I think advocacy, but also working hard to make sure that people in office are educated about the benefits of basic income. Was that an answer?
So I actually would want to turn to Leah. Could you speak on why the three areas that we chose are the areas that we chose?
The run-up.
Run, Leah, run.
There's not good reasons why not X zip code, X zip code. There's so many communities in need, but the program did a lot of community engagement. It started with community listening sessions in the old fourth ward. What do you need? And grew from there. And so the program, and it also depends on funders. Right now we're extending to the west side because there's a big stadium built by somebody who has some vested interests in the west side, right? So it's a balance, but the program would love to expand to every possible community. What was the second part of that question?
I think that was for that question, and then you.
Thank you, Dr. Hamilton. So as you can see from the overall funding strategy for In Her Hands versus the first project, you see it went from government to, and I know who she's speaking about, very, very phenomenal funder, but it shifted. So that funding strategy is a capital stack. It's not just coming from one place. There's a continuous need to kind of, as you alluded to, continuing to have different advocates politically, maybe even some from the corporate or philanthropic side. And so I think that as we as researchers continue to show the qualitative and the quantitative data, we keep records, we keep having these conversations, we're also going to have to find a way to get to the root of what makes things move in this country, and that's the economics. If we look at any legislation, any type of means test, or any type of benefiting the good, there's always an economic lens that's put on top of it. But then where the qualitative comes in, the stories come in, that's where media is our friend, which why it was such a pleasure to have the Photo Voice Project, or to be able to have you all come here and tell your story. So when we make both of those kind of marry each other and then be able to put them in front of key stakeholders, that changes the trajectory or the sustainability of the program, to your first question.
Hello, my name is Dr. Joy DeGrew, and I'm really so happy to see that these programs exist. I have a couple of questions. And one is, I know that Portland is a predominantly white community with a very interesting history of purporting the notion that it is open and embracive and weird. Promotes that as well. No, it actually says keep Portland weird.
Right, yeah.
So, and it is weird, but it is not welcoming to everyone, particularly people of color. It is not, and their history and laws are very clear with regard to that. My question is, given that you do not have the critical mass like there is here, in spite of the fact that we're in the South, there's critical mass here, and folks know that Black folks live here and have numbers that make a difference. And I'm wondering about engaging communities of color to not to one, show up for this, right, in large numbers, because that's my understanding of Portland, is that they pay attention when there's just a whole lot of people of color, or any more than 4 and there's a crowd, So one strategy. The other is multiple streams, right? And starting to look at a larger organization like MacArthur and Kellogg and those that are, kind of paying attention to that kind of reality. The other piece that I was going to also ask you, when I was doing my research on historical trauma, even though I wanted to look at things like vacant esteem and racist socialization, they keyed in on violence. And what we do know is that there is a connection. And again, violence becomes the big money, that everybody throws money at because they're scared, essentially. So everybody throws the money at violence, but they never look at what causes the violence.
Right.
And what causes the violence, one of those things is serial forced displacement, which started with, of course, slavery, Jim Crow, redlining, urban renewal. That sounds nice. And now it's gentrification.
Right.
So we know there's a considerable amount of research that shows that that leads to violence, which is connected to poverty.
Right.
You see what I'm saying?
Yeah.
So sometimes I think we have to be more strategic in how we are putting it out there. And of course, the stories are incredible and directly related to violence and the succession of it, right? We know that from personal experience in terms of domestic violence, but to start putting those connections that make them pay attention, because they don't care if you feel good, if you look good, if you like yourself, they don't care. You know, and so we have to begin to become more focused. And I'm wondering if you would have ever joined those major social issues of violence and
Interesting.
displacement.
Thank you, Dr. DeGrew. Dr. DeGrew is my aunt. And thank you for giving a 5-minute question that could be answered in half an hour. Yeah, that's an interesting idea. If we could create a map of basic income that shows a reduction in violence, that would be an interesting indicator. I don't know of a basic income. Do you guys know of a basic income project that has tried to show a relationship or correlation between those things?
I don't think I can.
Oh, someone in the audience. No. Yeah, this was Dr. DeGrew's question, was like, well, maybe if, right, yes. Mhm.
Mm.
Right? So that's why we have to have different arguments. Make them care or fear that.
Mhm. Yes. Okay, yes.
I can speak a little bit to the violence piece. My name is Kenya Jackson. I work at Grady Hospital with a project called Ivy, which is Interrupting Violence in Youth and Young Adults. And we're a hospital-based violence intervention program. And first of all, Dr. DeGrew, for real though, I'm just like texting people like, you won't believe who but but I did want to say, like, when you say there's a lot of money, I guess, in violence, there is, but only when you think about policing Black bodies, not about like keeping Black bodies safe. And so that's actually why I'm in here, because that's one of the big things I'm trying to look at is guaranteed basic income for the prevention of violence. But for every guaranteed basic income program, I don't really see the data coming across for like, how does this help people's safety? Or how does this make you feel safer? Because that's really where this lies, like the piece of violence of the root causes. There's a lot of root causes, obviously social determinants of health,
Right.
but the idea of safety and guaranteed basic income is one that just hasn't really been looked at, I think, yet. But I know that they're linked. I don't think that they're linked. I know that they're linked, because people who feel safe and people who feel like you guys, like this helped you feel, you felt like I can make it now, I have something, they don't shoot each other. And so I think it's a necessary link. And I think any links are good links, because we worry about sustainability too. And I'm in the field of violence prevention. Because you guys know it goes like, even when cities say they're gonna use money to improve safety, they really just mean policing.
Right.
And so I think that there's a piece there where we can all kind of work together for the sustainability of these programs and just be more wide in the net cast for what they actually do when you have guaranteed basic income.
Thank you. I think we have time for just one more question. I hate to do this. I mean, the energy is just building in the room.
It is.
And the discussion is really getting good,
We
but
better meet outside and finish.
I know we're already in break, so I just want to make sure everybody gets a little bit of the break as
So
well.
mine is quick. I wanted to inquire about inclusion exclusion criteria from the disability lens. My name is Dr. Dougleen Jackson, and I work in that space. And one of the things I always think about is the employability of individuals with disabilities. And when we look at intersectionality of identities who either hover at that poverty line or non-existent when it comes to income, with your inclusion exclusion criteria, did you think about disability and why was not that population present in the data that was presented today?
Okay, so we know that of the 100 Black women that were in the Multnomah Mothers Trust, some of those women did identify as having disabilities. My work group, the Multnomah Idea Lab, did not choose the women that were participants. That was left to the community-based organizations, Black Parent Initiative and Women's First. So they created their criteria for inclusion in our program.
Our program also had individuals with different levels of disabilities, from mental health issues to physical disabilities as well.
And also with that, also identity. And so one of our criteria was identify as a Black woman, identify as a woman. And so we had diversity in gender expression as well.
I would just be curious to reanalyze that data and share that narrative too. Thank you.
All right.
Thank you.
Okay, thank you so much to our panelists and presenters for that amazing discussion and on everything that you shared. It's very inspiring and eye-opening and educational. So thank you for that. And I really appreciate the audience for being here and bringing their thoughts to this discussion. And we were just getting warmed up, but unfortunately we are bound to time. So thank you all for being here.
Thank
and
you.
Thank you.
appreciate
Thank you, everyone.
each one of you.